So, good evening, everyone. We welcome you all to the TKM ICTP SLC webinar for healthcare professionals. The webinar will be a guide for doctors and nurses who want to improve their professional language. And the reason behind organizing a webinar like this is to keep you yourself or keep updated to the learners that the professional medical English have to be trained or have to be acquired in a different way. And we have got one of the world's best institute with us, actually, who will be telling more about the courses, more about how the professional language needs to be improved and all the thing. So I'm now of my best friend and managing director of SLC here with me joining for this webinar. And along with him, we have got Virginia Allum, who may be a very known personality for people who are in looking out for medical English programs, actually. So her materials or her books are very known in that space. So I take this privilege to invite both of you to the webinar. Now I request Chris to take the thing forward from here. Thank you.
Good evening, everybody. It's really lovely to be here. I'm talking to you from a very grey and rainy England. I hope this finds you all well. So I'm going to share my screen now, and what we're going to do is that we're going to talk just a little bit about us and why we're here and what we do, and then I'm going to pass you over to Virginia. Virginia will talk specifically about the what it is to be proficient in professional English and what that means in terms of the language that you need to get there. And then we'll come back to the kind of thing that SLC does and how we support healthcare students and professionals around the world. So I'm just going to share my screen, so do bear with me. Okay. So English for healthcare, improving your professional English. So something a little bit about us. So this is me. I graduated from Cambridge a long time ago, back in 1989. Since then, I've been in English language teaching in one form or another. I was a teacher for many years and then sort of went up the tree to become academic director. I used to run a school and that kind of thing. Worked all over the world. I founded SLC in 2012 and we really focused in on medical English in 2014. And since then, we've been working extensively with healthcare students and professionals from around the world. Virginia, my colleague, as Vinish mentioned, is very well known, not only for the work that she does for SLC, but for the work that she has done throughout her career in nursing, which she's a professional nurse, but also in medical English writing. She's published by Cambridge University Press, several books there. She's also writes for the OET, the Occupational English Test, which some of you may have heard of. She's a well-known conference speaker and trainer. And remarkably, she's actually a registered nurse. She works here in the UK and she's currently vaccinating patients every weekend. We're delighted to have Virginia on the team, and she's been working with us as our head of medical English since 2014. So SLC, what do? We really are a medical English specialist. We focus on medical English and we do very little else. So we provide medical English services, whether it be content or coaching or assessment, to students and professionals around the world. We are supporting nurses, doctors, but also pharmacists, radiologists, and other healthcare professionals to work in English-speaking environments, but also engage in the international healthcare sector. And to do that, we, as I said, we publish, we train, we coach, and we assess. These are some of our clients. We work extensively with the National Health Service here in the UK, but we also work with universities, healthcare employers, and healthcare educators around the world. So that's why we're here, because we've got something to say here, and I'm delighted that the person who's going to be saying it is Virginia. So I'm going to hand over to Virginia, who's going to talk really about what professional English is in a healthcare context. So over to you, Virginia.
Thanks, Chris. Well, unlike Chris, I am in the UK, but I'm up in the northwest of Scotland, and very happy to be speaking to you today. So first of all, we thought we'd have a look at what professional English is, specifically what medical English is. And really, when I thought about it, I was thinking that it can be seen in two sections. You're either going to see English, medical English, when you're speaking to English-speaking patients, perhaps locally, or colleagues, English-speaking colleagues locally. You might be using English as a common language in a healthcare setting. And the other venue, if you like, for professional English is in if you're working overseas in an English-speaking country, but as well as that, in participating in conferences or reading academic journals in English. So it's a fairly wide range of areas that you'll see medical English used for. Thanks, Chris. Next one. So when we think of proficiency, what are we thinking about? So we're really thinking about your ability to communicate effectively and efficiently, so that patients and colleagues can understand you easily. But more than this, and this is perhaps one of the differences with medical English, is that you need to be able to communicate safely, so that you are a safe practitioner. And if you can think of some of the times that you are communicating in a healthcare environment, you might be talking about some very important things like medication or side effects, and you have to be able to communicate effectively. So what sort of benchmark do we think about if we're looking at how proficient are you at speaking, at using medical English? And we often use the Common European Framework of Reference, and that's where you'll see the B2 C1 level, or you might be more familiar with the terms upper intermediate or advanced. So really, we're looking at a high upper intermediate, moving into the advanced level, for you to be able to manage the sort of complex interactions that you're going to have with patients or colleagues. If you're going to look at studying for an exam like the occupational English test, and this webinar isn't dealing with the occupational English test, but just to touch on it, the sort of level that you're looking at is to be able to reach the minimum pass mark of a B, and that equates to an IELTS 7 or 7.5. You are going to need to be at that high upper intermediate or advanced level. So what does that really mean in practice? You're thinking, how proficient do I need to be? So let's look at listening first. When you listen, you need to be able to listen to complex information, and that might be in a very rushed environment. For example, the emergency room. You need to be able to listen to a range of English accents and perhaps different intonations. What about speaking? What does it mean to be proficient in speaking? Again, this is being able to communicate in fairly complex situations. So it might be that you are delivering bad news or explaining a complex procedure to a patient. And you need to be able to do this with accuracy so that you are understood. And when you're speaking to patients, they need to feel that you are listening to them when you speak with them. What about reading? What does being proficient in reading mean? Well, this means that you have to be able to read workplace documents. So things like patient file notes, perhaps case notes, You need to be able to read charts and other other hospital documentation. But also, as I mentioned before, if you're wanting to participate in conferences, you might need to be able to read conference materials and also medical and nursing journals to keep up your practice. And finally, writing. So this means that you need to be confident in writing hospital type documents like a patient file note, perhaps you're writing a note to a colleague, or perhaps you're writing a discharge letter or a referral letter, or maybe a transfer form. So these are the sort of high level areas of practice that you need to be confident in, and this is what we mean when we talk about being proficient at that upper intermediate or advanced level. Next one, Chris. Thanks. So now you might be thinking, how can I improve my professional language? Well, we sort of got two areas that you need to be looking at. So the first one is looking at your core skills. And when we think of core skills, we think of using correct grammar, appropriate vocabulary, and this could be using medical terminology, perhaps with a colleague, or maybe being able to explain medical terminology in everyday terms with a patient. You need to be able to use correct pronunciation so that you are understood easily and accurately. And then we have what we call the soft skills. So being able to communicate effectively in areas that are quite complex. So being able to communicate so that people can understand you and you can understand them. So at all times, what you're ensuring is that you can communicate in areas with a strong practical focus. You need to be able to bring those medical English proficiency into your practical day-to-day use. And this is where the language needs to be relevant to your practice. And this is very much, again, why learning medical English is important rather than just general English. And it helps to build your confidence. And as your fluency increases, it also builds your confidence. And this is one of the main things that's very important before you start preparing for those tests like the Occupational English Test or IELTS. You need to feel very confident in your level and be proficient in the way you communicate. Looking at the two courses that were designed to help you with this, the first one is the English for Doctors course. Now this one takes you along the patient journey, and as doctors, you'll recognise the sort of skills that you're developing, starting from interviewing a patient, asking about past medical history, explaining tests, making a diagnosis, treating, and then finally discharging your patient. And Chris will put the next slide up so that you can see an example of some of the modules. And I think if you have a quick look at what is in that course, you can see quite a wide range of different areas of communication where you will build those skills, those soft skills and skills that will allow you to communicate in quite complex situations. And then we'll look at the nursing English for Nursing course. This focuses on areas of patient care, and I think you'll recognise those areas. For example, pain, pressure area care, falls and injuries, IV therapy, administering medication, and post-operative care. And Chris will pop the next slide up, which will give you a look at those modules. And again, just like the doctor's course, there's quite a wide range of different examples of communication skills that you develop, not only when talking to patients, but also when talking to colleagues. And so it's within the context of a particular area of patient care. So this is these skills are developed in various ways throughout the courses, and one of those is through the use of animated videos. And you can see an example of a screenshot of a nurse talking to a patient before she takes a blood sample. So you'll watch the video. There are activities around the video, so understanding what's happened during the dialogue, what sort of communication skills are used, what language has been used to develop those skills, and then you'll have a chance to play the role yourself. So in the nursing videos, obviously you'll play the role of a nurse, and you can record yourself as if you're talking to the patient, and then listen back. How did you go? How did your pronunciation compare with the video? And the same, it's the same setup with the doctor videos, but obviously you'll be playing the role of a doctor. So there's again some of the examples of the communication skills in the videos. You could be asking for information. You could be providing information, perhaps about treatment or a procedure. You could be explaining the procedure. You could be clarifying instructions to make sure that the patient understands what you've explained, or perhaps clarifying that you understand what the patient has said. You might be advising the patient about discharge, the discharge plan, what has to happen after the patient leaves hospital. Or you could be handing over information to a colleague during a handover, or perhaps just an informal discussion with a colleague. Other sort of activities that are used during the course to develop your vocabulary. I'm using medical terminology as an example. Not only becoming more familiar with medical prefixes and suffixes, but also to look at what everyday language could be used to describe, to explain those terms to a patient. You may find activities which practice the vocabulary of equipment that you will use during your practice, and also some anatomy, simple anatomy labeling activities. One thing I would mention is that there's practice in standard abbreviations and acronyms, and this is a particular importance if you're looking at working overseas, so that you feel comfortable with reading and listening to those abbreviations and acronyms. So these are some of the ways that the courses help to build that confidence in using medical English language. And as you can see, although with the medical terminology, some of that you could say, well, you know, this is we learn this in our courses. It's more about the way that you communicate those terms. How can you communicate those terms to a patient, and can you understand colleagues when they use those terms? So that's what I wanted to tell you about the courses, and I look forward to talking to you during the Q&A session.
Thanks, Virginia. That's great. Yeah, these are the courses we do. So we can see that Virginia has already highlighted the doctors and nurses courses, and these are some of the other courses that we do. In terms of the professional development of healthcare students and professionals, you know, one reason that we really started to focus on this as a company was because we realized how difficult it was for so many healthcare professionals and students to get hold of good professional English materials. People can't get to classes, but, you know, super busy, working long shifts, working difficult courses. And so the ability to access this kind of content is actually quite difficult. The other thing about getting to classes is that when you're in the classes, often the teachers of those classes are not very familiar with the content. So you guys as healthcare students and professionals really know in many situations a lot more than your teachers in some respects. For example, the medical terminology that Virginia highlighted earlier. So when we were thinking about this, you know, years ago, back in 2014, we tried to figure out the best way to get content, professional English content, to healthcare students and professionals so they could really use it and then practice it. Now, online clearly is a good place to go because everybody's online. So that's why we decided to go digital and put everything online rather than using course books. The great thing about online content is that you can update it. So if there's a new medical procedure or a new medical phenomenon, so COVID-19, for example, is now in the recent courses. So if the grammar course, which we released very recently, is full of references to the pandemic. And so working digitally allows us to keep up with you in a sense, because the world of healthcare is very fast changing. The impact of technology is right across the sector. So working with online allows us as a teaching organization to keep up with you as a healthcare, in the healthcare sector and the healthcare profession. So we designed a range of different courses trying to target the specific needs of professionals and students wherever they may be. And as you saw in the slides that Virginia showed, we're really trying to work on all the skills that you really need. So we're really trying to work on the speaking, and the speaking you can record yourself as part of a conversation and listen back. So technology allows us to do much more than was possible, say 5 years ago. But it also really focuses on building the vocabulary, getting accurate grammar, getting the pronunciation right, as well as developing the different skills. These are quite big courses. So the doctors and nurses courses are 100 hours of content. So there's a lot of content in there. Some of them are shorter. So for example, medical terminology, that's a 30-hour course, but it covers a very wide range of terminology from the sort of top of the head down to your big toe. The courses they're online, so we can get content to you and people are able to work it around very busy schedules and so on. The content is specialist, and as Virginia said, it has to be specialist. We cannot have general English content here because then you can't really use it in the place it's designed to be used. So it's profession specific, but it's also sector specific. The profession specific is the language, so related to medicine, to nursing, to pharmacy, and so on. But the sector specific is taking grammar and then contextualizing it in a medical in a medical context, so it makes sense. And that's really important for anyone who's looking to study professional English in healthcare, not whether it's our courses or it's another company's courses or it's stuff that you find on the internet or whatever it happens to be. You know, to get it in a practical, usable context, so you can see it on the screen or you can listen to it through your headphones, but then you have to go and be able to use it. And that is the most important thing. Here's the kind of usability of this language. It's not a thing which exists as a, like Latin or something. It doesn't exist as an abstract form. This is a living, breathing, usable language. And so it's really important for us as an education organization to really focus on that, to make sure that our students are taking the language, learning it and using it. The course itself is multimedia. It has to be very engaging. So there's lots of animated video. We can't get cameras into hospitals very easily, so we work with animated video, but there's lots of audio. It's very image rich, so it's very colorful all the way through. We use hospital documentation wherever we can, as well as excerpts from journals and research and so on. So we try and keep it engaging. It's really important because for us as an online organization and for you as an online learner, the competition for us is Facebook or YouTube. If you're doing a course online, you can just click and away you go. So for us, it's really important to make sure that the courses are engaging, dynamic, and people stick with them. The courses are all CPD accredited, so they've all been looked at by an external organization, and everybody who takes a course knows that the course has been checked out and there's an official certificate at the end of it. But this is all around developing professional English and getting it right, so you're able to learn the English that you need at work or in your studies. If you are in medicine, there's a range of courses. So the top ones here, these are all profession specific. So what you need as a doctor, what you need when you're researching, when you're reading research, when you're writing an abstract, for example, or writing a presentation for a seminar or a conference, this language is covered here. And then OET medicine is taken increasingly by doctors around the world. And so this really targets the test techniques here. But underpinning that is the grammar and the medical terminology. So these give you the basics that you need in order to support the more targeted professional English that you will be using when talking to colleagues, if you're part of an international team, if you're talking to patients in English, and so on. So this would be like a kind of a learning pathway, which takes a doctor in this case, or a medicine student from a B2, B1, B2 level. B1 level is the grammar and terminology. The English for doctors is more of a B2 level, but it takes you up from an intermediate level to an upper intermediate and advanced level. And something similar for nursing. Nursing, also a range of courses. We have the online English for care. This covers very fundamental nursing language and healthcare language at a kind of lower intermediate level. So it's a great starting point. It can be supported by the grammar course, the medical terminology course, but then move into much more targeted professional English content as the language level goes up. And this will take someone from a kind of an elementary, lower intermediate level up to an upper intermediate level where you can really operate effectively in a very wide range of nursing situations. There's also the OET course for those of people who are considering that route as well. So for those people who might be considering relocating to an English-speaking country. So this is how the kind of content, this is the design motivation is all around practical English and using English in a healthcare environment, whether you're working with colleagues, whether you're talking to patients, whether you're researching, attending conferences, attending seminars, whatever it happens to be. This is language which is targeted the needs of healthcare learners across the different sectors. So that is it really. So what I'd like to do is open up to questions. Myself and Virginia are here for the rest of the webinar and very open to take any questions. I'm going to stop sharing here and we'll open up the floor, so to speak. If I can ask Vinish, is there any questions coming in, Vinish, that you would like us to have a look at, or anyone at TKM ICTP?
Yeah, Chris.
Sorry, a little technical error. Yeah, I have a question here because you have been mentioning about the CPD certification.
Yeah.
For the group, can you just tell what will be the validity of a CPD certification for a nurse if he's taking up a course from you? And if you can just show how a course is designed and in your LMS or online thing, or for a practical view for a candidate to see how the course runs for a person, and how, whether it is self-paced, whether it is flexible, what would be the advantage for a nurse or a working person, for a student, how much they will be able to do the course on the go or along with the studies. And if you can just give a up a few more idea about all these things, it will be really good actually. Whether if think that I am a person who is planning to take up OET, what should I do in the initial phase to develop my language, and how this professional English needs to be developed. What should be the step one I should do, and where should I start off the thing? Whether I should start off from the nursing career, joining the course of as a nurse. That means when I join for a BSc nursing or anything, or should I start developing this language after completing my course and all those things. So if you can just give us a few idea about
Sure.
your thought process, because from your end, you may be working with medical English for a very long time. So you know that what will be the right way of developing a professional English for a person.
Absolutely. So that was about 10 questions, I think, but
Yeah.
I'll do what I can. So in terms of a starting point, I think it's really important to understand your level right now. So there are tests that we can provide, or tests that other people can provide on the internet, or tests you may have taken when at school or university, to give you a sense of where your starting point is. So are you an elementary level English speaker? Are you intermediate? Are you upper intermediate? Or are you advanced? So once you have a clear idea about your starting point, then you should be able to choose which course makes most sense for you. So the courses are leveled. So if you are a nurse, for example, and you feel that your English level is quite low, then it makes sense to start with the English for Care course. This covers a lot of language used by nurses in a range of different situations, but at a lower level. And that will build a strong foundation in language for you to do some more work, perhaps progress to the English for Nurses course. So it really depends where you are. Same if you're a medical student or medical professional, where are you? Get the assessment, work out what level you are, and then take the course. The course itself, they're all self-guided. I'll show you the LMS, the learning management system, in a moment. But the courses that we run are all self-guided, which gives you enormous flexibility. They're online, so you can join the courses wherever you have a connection, and you can take your time and you can do the course. You don't have to do them in one order either. You can choose which bit you want to do first. You can do unit 3 first, followed by unit 5, followed by unit 10, and then go back to unit 1. So there's lots of flexibility built in. We do recommend working with a mentor, and we do recommend working with someone who can support you in your learning journey. So when you do have questions, you do have someone to talk to. So it does make a lot of sense working with an educational institution who can support you with the course content when you have questions. In terms of the Cpd certification, the courses are all accredited by the Cpd Standards Office in the UK. So CPD stands for Continuing Professional Development. Continuing Professional Development. In the United Kingdom, every nurse, every doctor, and lots of other professions, accountants, lawyers, and so on, they all need to do a certain amount of continuing professional development in order to keep their professional status. So you have to show the Nursing and Midwifery Council or the General Medical Council in the UK that you have done some studies which will support you in your professional practice, and this will improve your improving your language skills is part of that in terms of non-native English language speakers. So the Cpd Standards Office accredits a wide range of courses. When they accredit a course, someone comes in as an expert, they go through the course, they look at the design, they look at the way that learning is assessed, they look at the potential incomes, and if they like it, they give you a stamp. And that means that anyone who completes the course then gets a certificate which has a Cpd Standards accreditation stamp on it. And this can be used not only in the UK, but the Cpd qualifications are now increasingly recognized in countries around the world. So for example, we work in Russia quite a lot, and the Russians are very keen on a Cpd stamp on the courses, because for them, it shows that the course has been officially accredited and checked and has a certain validity. So that's the impact of the Cpd qualification. shall I show the learning management system? Vanish, would you like me to do that?
Yeah, I have a question from a participant, because as
yes.
the webinar doesn't give, does not allow the candidates to speak up. So I've requested them to post the thing in the chat box. So there is a question from Rinimol Joy. So she was asking that how to improve my reading skills. It is a very generic question. So the question will be to Virginia. So if you can give us a few tips or your thought process on how the reading skills can be improved.
Yeah, sure. Before I do, can I answer, which will help in my answer? Can I answer one of your other questions? Vinesh, you asked at what point should a nurse or doctor start, or as a student, when should you start preparing professional language? And I think right from the word go would be my answer. And it's interesting. There's a university in Australia started a pilot scheme for preparation for the occupational English test, because until then students would do their degree, their nursing degree, for example, and then they would attempt the OET. And this particular university, the University of New England, brought in, for international students, brought in medical English classes right from the beginning of their course, so that they went through all the way through learning and developing their reading, writing, listening, and speaking skills, so that by the time they'd finished their degree, they were their proficiency levels had increased. And I think getting to the question about how do you improve your reading skills, really any of the 4 skills, the answer is the same. It is a gradual process. You need to be looking at relevant texts, for example, and there are a lot of those available to anyone. PubMed examples, websites that talk about health topics, reading critically. And when you do your Bachelor of Science in Nursing and Medicine, one of the skills that you are taught is critical thinking. And so critical reading is the same. So you read a text, you ask yourself what the text is about. You look at the structure of a text, and this is where understanding grammatical structures and the way a text is written, how is it set out with the paragraphs. And you look at any terms that you may not be familiar with, and you start developing your own word list, your own little notebook of medical terms that you come across. And when I used to teach the Diploma of Nursing in Australia, the first thing I said to students was, start your own notebook and write down any terms that you don't know, find out what they mean, and then think about, if I was going to explain this to a patient, or for example, how would I explain this term to a patient? And that helps in several areas, not only in your reading. It helps in your writing, because you practice writing so that you get the spelling correct, but also in your speaking. So my advice is to not to split the 4 skills up in a sense. They are all part of a whole. So you'll be reading, you'll read something, you will perhaps talk about it to someone, you might write about it, and you might listen to a colleague or a patient using that term. So it's all part of a whole. Does that explain? Is that sufficient for your listener?
Yeah. Yeah, there is another question which have come from the candidate. It says that how long will it take if I join the English for Nurses courses? My current level of English is 6.5, and she have got that score from IELTS in all modules. So, Chris, if you can give a clarification on this, it will be really.
Sure. If everybody can mute their microphones, that'd be great.
Can
we mute the microphones? But yeah, briefly, if you have a 6.5 in IELTS in the 4 papers, that's a good level. So firstly, congratulations on getting that level. Shows your English is pretty good. I think the English for Nurses course is designed to be 100 hours of content. And that is a realistic number of hours to take the course if you are at probably an IELTS 5.56. So if you're a 6.5, you can do the course a bit quicker. But you're still looking, it's a lot of content, there's a lot of things to do there because the language of nursing is complicated. And all the different conversations that you're involved with and all the different scenarios you work with does take some time. So we would probably anticipate, even with a 6.5 level, you're still looking at sort of 70, 80 hours of applications of doing the course, but you will cover a lot of content in that time.
Yeah, and there is a next question from Pooja. She's saying that she have got IELTS 6 band 10 year a little time back, and she's planning to write an OET exam.
Okay.
Whether she required a training or not.
100% yes. OET, we do a lot of work with OET, and Virginia is actually a writer for the OET test. So Virginia can tell you a bit more in detail, but in our experience, nurses and doctors who just go and take OET because they are nurses or doctors don't pass. To get the OET at the level required by most nursing or medical registration bodies, regulatory bodies, which is a high level, it's the upper intermediate advanced level that Virginia referred to before, you've got to understand what you're doing in the test. You've got to understand what formats are coming, how to answer them quickly and effectively. In the writing, you've got to understand what the markers are looking for. We've had English-speaking, native English-speaking people take OET and fail. Their English, of course, was fantastic, but they didn't address what the examiner was looking for. And the same in the speaking as well. So the speaking, you've got to understand what the examiner is looking for. If you don't understand that, there's a very high chance that you won't get the grade that you need. So absolutely. Virginia, do you want to add something on that question?
Yes, I was desperate to unmute. I think one of the main things to think about with the occupational English test is that it is an English language test that is based in a healthcare context. So it's quite different from IELTS, which can be on any topic. That's the first thing. The second thing I would stress and highlight as well what Chris has said about the format of OET. It's a very specific format, and some of the sections you don't have much time to do them. For example, the listening A. It's a matter of understanding what you're asked to do in the OET and feeling comfortable with that format. The other thing I would say is that in the OET, the speaking consists of 2 role plays. Now, a lot of what you develop in a medical English course, for example, the English for Nursing course, is very relevant to that because it's all about displaying your communication skills. But there are very clear marking criteria for each section, and they are readily available, and you can go through and see exactly what is being looked for during the speaking and the writing test, for example. And it's something that you do need to prepare for, but you need to be at a sufficiently high level, like a good upper intermediate, to start preparing for the OET.
Okay, thank you, Virginia. And there is a good question from Gisla. What she's asking is that she is a first-year nursing student right now. And how does this courses, or how does the courses that has been put forward will help her? And because she have got 3 years to finish the course. So, yeah.
Can
so
I answer that one?
So Chris, if you can just...
Do you mind if I say
Virginia.
something?
Yeah, Virginia's better at this than I am. Yeah.
Just out of interest, I had a look yesterday at the Bachelor of Science Nursing curriculum for India, and as I mentioned before, I used to teach nursing in Australia, so I was very interested to see what was covered in the course, and 100%, starting with some of the courses that we provide would be a great help, because it covers exactly what you will be learning. You know, all the aspects of patient care. It's covered in our course, and so I think you would find it extremely useful. I did notice also that you do 40 hours of communicative English within the Bachelor of Science Nursing, and again, it maps across very nicely to what you will be experiencing in your Bachelor of Science Nursing in India.
Yeah, can I just say also that it makes a lot of sense for both nursing colleges and medical universities to be integrating English into the curriculum, whatever that looks like. And if that's not done at a sufficient level, then for people to be studying independently, because ultimately global healthcare is global. And if you're going to be talking and coming across to people in English on a regular basis, so whether it be patients or other colleagues or nursing journals or attending an online conference, you're going to need more and more English as this stuff. Like if you look at the pandemic, all the research and the communication around the pandemic has primarily been done in English. And this is just a kind of reality these days. You know, it's very lucky for us to have the English, but it does make a massive difference if you are able from year one, you're starting, and that gives you a lot of time to really build a very strong advanced level of English over the 3 years that you're studying. Vineesh, any more questions, Vineesh?
Good evening, sir. My name is Ganesh.
That is from Neetu. So she's asking that, is it necessary to complete the speaking? This is very specific to OET. And she's asking whether it is necessary to complete the speaking test within 5 minutes. So the question, if Virginia can answer this thing, it will be good.
It's a difficult one. Basically, you have two different role plays of 5 minutes length each. And they are recorded. You go in, you speak to an interlocutor who is not your assessor. The interlocutor plays the part of a patient or a carer. Now, after the recording of your role play is made, it is sent off to be marked. And so ideally, you will complete everything on the role play cards, but you may not be able to. And sometimes there's a good reason for this. Sometimes the interlocutor who's playing the part of a patient takes you off the topic a little bit and wants to know something else. But when you explain that something else, you do it really well and it's very clear. So that's, they will take 5 minutes of your role play. So it could be that within that 5 minutes, you've explained something very, very well, but it took a little bit longer than expected. So that would go in your favor. So really, the whole role play is taken into account. You know, how did you manage the whole role play in general? You know, did you cover as much as possible? And within those role play cards, you're given some suggestions about some of the things that you might talk about, but you're not expected to talk about all of them. They are just suggestions. So, you know, within the brackets, there might be 3 suggestions. You might only talk about 2 of them, but talk about them really well and clearly. So that's all right. There's more, the most important thing is that you are able to show that you can communicate clearly, that you can, that your patient or the patient or the carer, in the case of the carer of a patient, is able to understand what you're saying, that you've listened to them, that you've clarified anything that you don't understand, that you've displayed as many communication skills as possible. And that's the critical thing. Not that you've gone for 5 minutes from beginning to end, but not really communicated very well. So it's all about the quality of your communication in the speaking test. And that is why you are given 2 role plays, because sometimes people have asked, well, you know, it's very difficult to just talk for 5 minutes and talk well. Why don't they give us a role play of 1 role play of 10 minutes? And OET have always said that they feel it's unfair to do that, that it's better to give you 2 opportunities to display what you can do. And that's what you have to keep in the back of your mind. I'm coming to this role play to show how well I can communicate, how clear are my explanations, what's my pronunciation like, does the way I stress words stop the patient from understanding what I'm saying. So it's all about the quality of your communication, not the fact that you can start and finish within 5 minutes.
Yeah, this really is a test of professional English. So to, take a test, take the OET effectively, you've got to have the professional English skills to be able to do that, to do the role play, but to do the other papers as well.
There is a last question, and with this we'll wind up the webinar. The question is that the current level of the candidate is band 5 or in between 5 and 5.5 in IELTS. If he wants to gain a score of 7 in LSR and 6.5 in writing, what should be the way he should work, or what would be the ideal thing that he needs to go for achieving this course?
Sure. Well, I think the first thing to think about is whether IELTS is the right test to take. IELTS is a test of academic English. So it's used by all the universities in the UK to see if international undergraduates and postgraduates have the right level of academic English to study on an English delivered course. It's a big test, IELTS, and it takes people literally hundreds of hours to go from a level 5 to a level 7. And this is not a healthcare focused English. This is all kinds of English. Because it's an academic English test designed for universities, you really have to have vocabulary which covers a very wide range of areas, from environmental change to social trends to history and archaeology. I mean, there's a ton of stuff in there. So before the OET was recognized in the UK, we used to teach a lot of nurses and doctors IELTS, and we still do some, but it takes people a long time to get there. If you're level 5 IELTS now, I would strongly recommend considering OET, because OET is the language that you will see in your professional life. and you'll hear in your professional life. There's a much stronger crossover, and in our experience, people don't need nearly as much study time in order to get the levels they need at OET than they do in IELTS. IELTS is a big journey, and you need a lot of support on the way from an IELTS teaching institution or IELTS teachers. OET, you can make a lot of progress in a self-guided way because you're learning the professional English that you hear and see and read around you. And once you get to a certain level, you can then work with a teaching institution to get you to the levels required by the US or the UK, for example. But yeah, IELTS is a big one. I would recommend looking at OET as an alternative.
Okay, so that's the thing. Now the time have gone. Time is 6 o'clock. See, we planned to finish off the webinar by 6 p.m. So I thank Chris and Virginia to take out time and join with us for this webinar to give an overview about how professional English needs to be developed, how the proficiency need to be kept for building the career, and how the courses of SLC is going to help candidates in improving their language in their workplace part. So I request and I thank each and every candidates or the learners who have joined with us in this webinar. We'll be having a follow-up webinars coming up. It's a series of 4 webinars. This is the first one. We'll have another 3 coming up where we'll be discussing about OET or the healthcare, how the healthcare communication can be adapted by a candidate while doing studies. We will be discussing a lot of things on those those angles also. So so for more details about so for the more details about the courses, the pricing, and all those things, it is available with TKM ICTP website. You can log into that, and for any queries, you can send mail or give a call to us. We'll be able to help you and telling more about how you can enroll yourself into courses and how it can be taken forward. Up to my knowledge, I feel the courses that is designed by SLC as a very flexible course because it's self-paced. The beauty of the course is it's self-paced and it's self-explanatory, and it covers a lot of context from the nursing or the doctor domain, and it's end-to-end from that particular domain itself. So the person who is learning or who are into nursing will very well adapt to the content on a very faster mode, and you will find yourself as a learner who doesn't require too much of a support to cross one level to another. And second thing is that it's CFR mapped, because Common European Framework mapped content, because where it is going to be from a very basic level to a proficient level. So according to your communication current levels, you can adapt the course so that it will suit to your requirement, and you can easily work on that and take the thing forward to next level. And like someone was asking what it is going to help me as a student on a first year, I will say that I have seen people who have been writing competitive exams 5 times, 6 times, writing OET or IELTS so much of time, and they have tried and they were not in a position to get the scores that is required. So I will say that it is better to start the time when you are in studies, because you will have a more focus towards studies only. If you are able to develop a good language in the initial phase itself, I will say that it is not for passing out OET. Overall, you can see an improvement in your language. If you are able to make an improvement in your language, it is going to help you in achieving a best scores in your studies also, because language plays in all angles, not even for passing OET. It is very much required for your academic performance. So think on that angle and adapt a course that is well suiting to you. So so that is the reason why we thought that it's a time to educate people and get them aware about more about medical English, possibility of learning medical English, and go forward and achieve the career aspirations that you are having. So once again, thank you very much for joining in this webinar. I especially thank one more time Chris and Regina to take out time and explain things on a very in detail way. And I thank all the people from the working part to the candidate to the students who have joined with us. I hope that you will have a look on the courses. We have got a provision of seeing the experiencing. If you want to experience how a course works, you can fix up an appointment with us, and we'll be able to share you the same thing over video on how a course works how a course of SLC works with you. So you can take out a few 5 or 10 minutes time and see how the courses is going to help you, and you will really feel like it is very adaptive to the learning for a learner. Okay, so that's all from my end, and thank you once again for joining the webinar. Thank you very much.